Hi everybody, this is Tom Etges, family physician. I was asked to include a introduction that might be helpful for patients new to my practice, or perhaps patients that have been referred and might be wondering, well, what to expect, or if I've had a referral come from either my primary care or sometimes my chiropractor, physical therapist, my fascial therapist. What might I expect? Now, I thought I'd keep this discussion, this particular video segment, to a kind of how do I work, which might be different from other family physicians when it comes to a musculoskeletal problem. And it might be very similar, but the things that we may offer at our office might be a little different, and hopefully what makes our group a little bit novel. So let's take an example. It's not an uncommon scenario in my everyday to have the fortune of having a referral for a musculoskeletal or a chronic pain issue. It might be an injury. It might be an old injury. It might be pain following surgery. It could be someone interested in some non-surgical approaches to a particular pain problem. So if by the point of listening to this, if you've already been in my office, this is probably something we've talked about. But I think for new folks or folks that are considering making a visit to our office, I thought, well, this is kind of how my office operates. First of all, it's to make sure that I'm able to handle the problem. So I have a self-selection process because there are certain things that I'm able to offer and some things that I think are much better handled in other offices that offer a much different skill set. Two, sometimes I'm referred patients that may actually come in with one idea of how they think might be the way to go, and my first visit oftentimes is to go over options. So I'm a fan of saying I like to be the advisor in the room. I don't like to tell people, never, hopefully, do I ever do that. But it's more of a how can I consult? How can I best provide what my skill set might be able to offer those folks looking for something that maybe they haven't had a chance to explore in the past, or maybe they're looking at ways to complement their Western medical approaches with medications. Maybe they've been working with a personal trainer, a physical therapist, and they've discovered that there's some areas that seem to keep showing up as far as pain triggers. So I'll give you an example. Someone within the past month with recurrence of medial or inner knee pain, patient in her late 40s, early 50s, an avid runner, previously had been avid with softball back in the day. She has done swimming, she's done walks and hikes, and likes to ski in the wintertime. But she had done a sort of an interesting series of injuries to the knee over the course of time. And now she's left with some inner knee pain that just keeps bugging her when she's trying to do some of the sports that she would like to do, or just activities that she would like to get a hold of. She's had x-rays from her primary care provider. She actually also went to see an orthopedic provider, and x-rays and imaging were pretty unremarkable, except for some mild degenerative arthritis. That's what the intake indicators and imaging study showed. Well, how do I approach something like this? The first thing we'll do is take a comprehensive history, going over records, going over imaging studies together, and making sure that we're kind of all on the same page. That's usually what my first visit looks like. We may not have time to do a treatment or an intervention at that time, but it's a good way to kind of get a roadmap. I kind of call it a lay of the land, if you will, because often I end up being consulted, sometimes not first or second, but sometimes third, fourth, or fifth in a chain of very experienced clinicians. So I like to take that opportunity to really make sure we're all on the same page. Second would be doing a appropriate, dedicated, focused exam on the area, but also taking into account that some of the structures that we may be talking about might be interrelated for all the right reasons in maybe a different model. In osteopathic medicine, they may look at the body in a way that makes sure that we interface not only with the knee, but also the mid-back, lower back, and the neck. In acupuncture terms, in orthopedic descriptors, there are some things that the old Chinese lineage would not necessarily have a way of describing what you can see on an MRI of somebody's knee, but they may be able to say, well, maybe there's some reasons why acupuncture using electrostimulation in many cases might be a good way of achieving pain management, especially in those who don't have a lot of architectural damage or tears or degeneration. That might be another tool, which is something that we can talk about and offer, or possibly myofascial therapy, working with on-site and local and community myofascial therapists who are working on the body from a tissue and fascial standpoint in maybe a different way than maybe what they've received with other types of massage therapy. Many times they may be already working, for example, with a chiropractic provider. So if that's already been done, and maybe if those results haven't been optimal, then these are other ways that we might start looking at the problem, possibly with acupuncture. Then I would say that depending on the nature of the injury, those patients that I see newly either to my practice or new to a practice like acupuncture, they may decide, well, maybe that sounds like a good way to start, because I've already had maybe a steroid injection or two. Maybe I've been working with medications already. Maybe I already have a physical therapist. So those other providers are going to continue to do what they are best at, and what I may be able to add in at that point might be a series of acupuncture treatments. In a separate video, I'll talk a little bit more about what in orthopedics, what musculoskeletal or neuromuscular or neuroanatomical acupuncture can offer someone with joint pain, injuries to tendons or ligaments, and so on. The other areas that we offer at our office include orthobiologics. This would be another way of describing what is prolotherapy. Orthobiologics, regenerative joint solutions are all founded in an area referred to as prolotherapy, regenerative joint therapy, depending on the author and the source of information. There are indeed some areas in orthopedics, musculoskeletal medicine, sports medicine, pain management, where after assessment and with careful history and physical imaging studies, it may be best in some reserved cases that prolotherapy or regenerative joint solution injections, which I can describe in a little bit, may be one of the more beneficial ways to start the ball rolling, if you will, especially in those patients where they have already explored and received appropriate assessments and treatments, which may include all the above, from medication management to corticosteroid injections to appropriate physical therapy, chiropractic, manual therapy, and so on. But in some reserved cases, there may be very well-researched reasons why prolotherapy, using in a series of injection solutions, which may incorporate a method of stimulating your own body's healing mechanisms to come to the forefront, that may in some patients be what they are looking for. And that may be something that we could explore at that first visit as far as put it on the option list. we find that many of these techniques go well together. So there's not unusual that I have patients that are receiving acupuncture on a scheduled basis, working with their physical therapy provider. They may be periodically working with a chiropractic provider. And if and when something like regenerative joint solutions are considered, or prolotherapy, those may be complementary to all of the above in a way that would be very different from what acupuncture may be able to offer, or what physical therapy has been able to offer to that point in their healing experience. So with that, I hope this summary offers a little bit of an insight about how I work, how in pain management, for example, what goes through my mind when I look over a person's new patient intake form and meet them for the very first time. So that might be something you might expect. Obviously, if there's any more questions about what we may be able to help with your specific pain problem, please don't hesitate to contact our office for more information. It's been nice chatting. You guys have a good day, and hopefully we'll meet soon. Take care. Bye.